Okay, our case today is an 11-year-old boy. He's a third order of birth, right-handed, born and lives in Sohag. His second primary year in education, دمج. Family history, positive consanguinity. His parents are paternal cousins, no other relevant family history or similar conditions. He is born full term by CS delivery. He had normal perinatal history except for maternal anemia during pregnancy. He had delayed motor and mental milestones. He walked by the age of 4 years. He is born with bilateral squint. He had 2 corrective surgeries but failed. He also had a hearing deficit at the age of 9 months, but he was diagnosed as ear effusion. He was operated, and the hearing is normal since then. He has delayed academic achievement, no fever or trauma or seizure. The mother complained of frequent falls. The condition started 10 years ago with gradual onset progressive course. At the age of 1 year, he was a floppy infant. They sought medical advice multiple times. He was treated as osteomalacia. He had delayed all motor milestones. He walked by the age of 4 years. Then the mother started noticing that the patient had difficulty in climbing stairs and frequent falls. He also had difficulty raising his arms above his head. He had generalized atrophy and no fasciculations. He had also exercise intolerance and was diagnosed after that as myopathy. All through the history, there was no other symptoms, no bulbar, no neck muscle affection, no muscle pain, no cerebellar or sensory symptoms, no involuntary movements, and no sphincteric affection. So he's an 11-year-old boy. He is a third order of birth with positive consanguinity, a past history of congenital bilateral squint, delayed developmental milestones, presented with gradual onset, progressive course of 10 years duration of quadriparesis of myopathic affection. General examination, he has a high arched palate. I also wanted to take your opinion about his facies. That's why I'm not commenting on it. No other positive findings. The neurological examination, he is conscious, alert, he's mentally subnormal. The cranial nerves all intact except for bilateral divergent squint. He had a fundus examination. First time was normal, second time he had a pale disc. Motor examination, he has proximal weakness, quadriparetic, grade 3 to 4. He also has trunk muscle affection and bilateral scapular winging. He has generalized hypotonia and atrophy. His reflexes are diminished all over and no other findings in the neurological examination. His investigations, the CPK level was around 300s, and the follow-up, the latest one was 136, so it was never elevated. He did an EMG, which had myopathic changes. The VEP had retinal demyelination. He had an MRI muscle showing mild generalized atrophy and fatty infiltration. The CT and MRI brain were normal. His echo was normal. He also did a genetic study that was negative. Whole exome, yes.
This is whole exome sequencing in centogene and it is negative. وطبعا بروفيسور ادواردو قال لنا ان 50% 50% of whole exome sequencing it could be negative for many reasons.
Our differential diagnosis was congenital versus mitochondrial myopathy. We have the patient with us.
You have the patient. Yes. His EMG was myopathic and CK normal?
Normal.
Serum lactate and pyruvate? Normal.
Yes, and he repeated them 2 weeks
What
ago.
about the fluctuation of symptoms? Because you said there was ocular?
He's born with congenital squint.
Congenital squint. And this was not fluctuating.
No.
And his condition was not fluctuating.
No, the mother reports a gradual progressive course all through and maybe stationary.
Usually when I have a patient and I have this whole exome negative, I usually revise the condition again and ask about myasthenic symptoms.
Okay. I asked if there was no fatigability or diurnal variation all through history, and by examination there was no fatigability as well.
Can you see the patient with professor?